All right, what's up, everyone? My name is Alex, and this is my 1 year and 2 month update after getting the Pectus Excavatum nuss procedure done at Mayo Clinic here in Phoenix, Arizona. Thankfully, I live here, so it's a little bit easier for me than people who have to travel. Done by Dr. Jarzewski and her team. Great team. Great surgery. It was my first ever surgery. Hopefully, the only other surgery I'll ever need is when they take them out. They said it'll be about 3.5 years. I have 4 bars, so I think that's the max they'll do. I believe typically they do either metal or titanium. So I have the titanium bars, so extra special. I basically had shorter ribs on this side. So even now, like the look is not perfect. To be fair, I lost maybe 25 pounds after surgery, so it's pretty recessed a little bit, like kind of under where the pec muscle is. But recently actually I've been paying more attention to like my training and nutrition, so hoping to put on like 30 more pounds. And maybe the next update, as someone requested, I will show a before surgery and at that 2.5 year mark pictures. But as of right now, sorry, honestly, I'm just still a little bit too insecure to show those pictures. So, but eventually I will. So, stick around, subscribe. I don't care. But I want to go over some of the questions that people commented on my 5-week video. So if you haven't seen that, go watch that, because I'm much more fresh out the surgery. I talk a lot more about the pain and stuff like that, which I will address now that it's been 1 year and 2 months. Yeah, and I think, I forgot to say, I was 27. Someone asked that, and I replied in the comment, but I was 27 years old when I had the surgery. I'm 28 now. So, it's not necessarily something that you need to have like when you're a teenager or, kind of around that age. So it's been, in terms of surgery, so far so good. So, but someone mentioned compression cosmetics. And I don't remember this person's name, so if you watch this, you'll probably know it was your comment, that you said you felt compression, and you haven't had the surgery. So, as someone who was the recipient of a lot of, family doctor types, other medical people, not necessarily specialists in this field, telling me, nah, you won't need it, kind of a shrug off. When I went to get checked out at Mayo Clinic and they actually did the testing to kind of determine if I would need the surgery, I had lung compression, heart compression, slight displacement of my heart as well. Nothing that was really affecting my health, but it was definitely affecting me internally and covered by insurance. So, yeah. So if you're feeling compression, anybody watching this, and you haven't had the surgery or thinking about it, go get checked out, because if it sounds like you probably need it, and it would be covered by insurance if you have insurance. So that's good. Yeah. So compression cosmetics, cosmetically, like I said, I lost a lot of weight. If you're kind of into fitness and you're familiar with the term hard gainer, that's kind of where I fall in. So I'm doing a lot of eating right now, and just started kind of training more again because I was hella unmotivated for probably up to the 8-month mark, maybe even more than that. Didn't go as much as I used to kind of work out and stuff, just because I enjoy it. But yeah, so I'm looking more into that now. So again, hopefully at the 2-year mark, I can show some pictures and I feel better about myself. But yeah, so another person asked about regrets and if it was worth it. A year later, yes, I do think it's worth it. Just purely because it sucks. Like, the whole process sucks. I'm not really in pain now, but every day, 24/7, except when I'm sleeping, of course, I have the feeling. It's like, the best way I describe it to people is if someone like is wearing metal gloves and is just squeezing your midsection, like this area where the bars are, just squeezing your midsection all the time. Not to the point of pain, but to the point of like, you feel it, and it's really hard to describe it. When you get it, or if you get it, you'll understand. but it's very hard to describe to other people, but that's just what I say. It's like, imagine someone just squeezing you all the time. And you feel it, and you can't do anything about it, which is great. So yeah, but still worth it. Yes, just for the mere fact, if you have this condition, the pectus excavatum, I know I sympathize with your insecurity because I had it for many, many years. So yeah, cosmetics alone, yes, worth it. Regrets, I definitely had regrets when I was still feeling pain, because there's nothing worse than feeling pain that you can't do anything about. There was a while, for maybe almost a month, where I would just get random stinging pain, like right in the middle of my sternum, because I believe they had to put one or two pins or something just for stability. Um, and I couldn't do anything about it. Like it sucked. It was so frustrating. Um, but overall, I don't regret it. Yes, it was worth it. So hopefully that answers your question in more depth than you wanted. How old was I? 27. I addressed the pain. I guess I'll kind of go over this again because I remember talking about this in the last video that I did 5 weeks after surgery. It is really annoying when people ask about the pain and you tell them about the pain, and then they try and like compare it to something that maybe that they've experienced, or people compare it to giving birth. Good for you. If you have never had this procedure, you don't know what it's like at all. And if you're someone that has like a family member that happens to be watching this, that doesn't help. It doesn't help to be like, well, at least it's not. No, not helpful. The best thing that you can do as a supporter of someone that might be getting this procedure is just be supportive and help them. You can't, I couldn't lift anything. Like, I couldn't get out of bed myself, and eventually I had to swing myself out of bed. And it hurt every single morning. It hurt. For 2 months, let's say, it really hurt. By month 3, it hurt, but it wasn't a killer. And then as time went on, obviously at this point, a year and 2 months later, I just get out of bed. I'm still stiff. Like I can't, like, the thing in school where you twist on a chair, pop your back. Can't do that. I've got metal. It's not flexible. I can do the thing where you lay on a yoga mat maybe, and you stretch one leg over your body, and then you turn your upper body the other way. I could do that now, which actually is surprising to me that I can even do that. So I can kind of pop my back a little bit that way. But yeah, I'm mostly pretty inflexible. But anyways, sorry. If you're someone who's going to be a supporter, family member, just help them, and don't get annoyed and think like, oh, you could do that. No, they can't. They can't. It sucks. Yeah, it really sucks. Someone mentioned they have, I don't remember if they mentioned they have back pain. I think this person had mentioned that they got the procedure and had back pain. Yes, at early stages, I did have some back pain. And yes, I did mention that in one of my follow-ups. I remember now. And they mentioned it's because your whole upper body is pretty much readjusting itself to muscles are moving, everything is in a new position. My back was sore for a while, like sore as F. I'm not going to cuss because, I don't know if kids are watching this. Not that you don't know your cuss words, but sore as F, and it sucked. So it wasn't a stinging pain like I would have kind of on this side in particular until I started stretching more the muscles. Like I forget what it was. There's a connector in here where your pec muscle kind of comes in your arm a little bit. Oh my God. Pain, like, ooh, like if I would stretch the wrong way or like pick something up that was too heavy, oh my, the shooting pain was crazy. So that was probably the only real significant muscle pain that I experienced. But back pain, really just soreness for me, nothing painful. So hopefully that person, you know, if you end up seeing this, got checked out for that, or hopefully it's gone away. Sleeping. I still sleep on my back every night. I'm just used to that now. And that's another thing that caused muscle soreness because I always slept on my side, sometimes on my stomach, sometimes on my back. I'm the type of person to just kind of roll around and sleep. I can rest on my side a little bit, but because I have 4 bars, the lower one is at like the lowest part in my ribs, it almost like starts to weigh down on whichever side is touching the bed. And so I do still at this point have to carefully like roll myself back on my back. Um, but I just like sleeping on my side. Sometimes it's comfortable, so I'll do it. It's kind of like some relief, I guess. I don't know. But yeah, so even a year and 2 months later, I'm still back, sleeping on my back. Excuse me. But yeah, I think those were the main things that people asked about. This is actually going a lot longer than I thought it would. I could talk for days just about how it sucks, but how it was worth it. So I will end on this note. Again, if you haven't seen my 5-week video, go watch that. If you're scared about the surgery, I was too. I've never had a surgery. I was really nervous about going under, but it was fine. I remember I said something and then immediately passed out. So yeah. What else? That's really it, I think. You know, working out. Okay, if you're, I'll end on this. If you're like kind of a hard gainer or you really like working out, especially if you really like working out like I did, it's gonna suck for a while because you cannot work out. And going back in, I could barely do like 5 to 10 pound dumbbell bench presses. So now I think I got back up to 60 pound dumbbells for a few reps. So not great. Not where I used to be, but good considering, you know, I do. And if you're getting the surgery or you have it and you're kind of in the earlier stages, be patient. Do as I say, not as I do, and be patient with yourself. I'm still not patient with myself sometimes, but you really need to be patient with yourself and just remember, dude, like if you had someone cut into you and put bars in and push your sternum up. Like it's a big procedure. So just be patient with yourself. And yeah, so I know I rambled on this video, sorry. But I hope you guys watched all the way through and hopefully it helped a little bit. As I said in the last video, if you have questions, drop them in the comments. I've had this video for like 10 years and I make a video about something random once in a while. So I'll see the comments and I'll reply when I can. And when I do an update video, you know, maybe I'll be big enough to do some pictures or not, or it'll be the next one if I'm still insecure. So yep, hope you guys enjoyed and yeah, peace.